Hi, welcome to another Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, the dermatologist here at the hospital, and we are lucky to have two special guests, both of the surgeons, Dr. DeHowich and Dr. Stockdale, and they're going to be talking to us about total hip replacements and hip dysplasia. So total hip replacements are a huge surgery, and we're actually the only hospital offering a surgery of this caliber, and the only hospital in all of Central Oregon offering this surgery in particular. So we definitely want to get the word out that we are doing total hip replacements in dogs, and I want to give you the information to know if you or some other pet that you know may be a candidate for this type of procedure. So to get us started, we're just going to do a few little introductions. So if you guys want to introduce yourselves and give a little bit of your background and education for our audience, that would be great.
First. So I'm Steven Stockdale, and kind of born in Oregon but raised in Washington State. Did my schooling there, and then my post veterinary training in the Seattle area. So relative recent addition to the Oregon area in this hospital. I'm very excited to be here, and I enjoy being outside and skiing and everything that Central Oregon has to offer.
I'm Mauricio DeHowich, and my training's kind of been all over the place. Pretty much grew up in San Diego, but been all over the place. School for veterinary school was at UC Davis. Eventually spent some time in San Diego, then Colorado, and then did my residency program at Iowa State. Then went back and practiced at San Diego for 5 years as a surgeon. And then was faculty at the University of Florida for a couple of years before eventually moving back here to Oregon.
Awesome, thanks guys. And then if you're just joining us, we're talking about total hip displacements today and hip dysplasia. Feel free, it is a discussion, so feel free to ask questions as we go along. We have Shelby on the camera, and she will also be fielding your questions for us. But I'm going to start the discussion. I think a lot of people have heard the term hip dysplasia and may not know exactly what it is and how to even know if your pet has that. So Dr. Stockdale, what exactly is hip dysplasia? What is going on with these guys?
So good question to ask right off the bat. In kind of a simple form, people are probably familiar with where the hip joint is. It's very similar on people as it is on dogs, but it's this ball and socket joint that attaches our femur to our pelvis and the rest of our body. Hip dysplasia is basically just malformation. The ball and the socket did not form right in the patient from birth, and when that ball and socket is not a perfect marriage, you get either increased motion or movement, and then eventually damage to cartilage, which leads to arthritis and pain.
So this condition is definitely congenital and hereditary. So there's really, it's either like you have it or you don't. There's nothing you can do to prevent it, or can you prevent some of the signs?
A lot of it ends up being likely hereditary or genetic. It's probably multifactorial, but seems to be something that can be passed along to other animals in the breed. And so not a lot that can be done to prevent it per se.
Okay, awesome. And then as far as diagnosing it, can you, let's say, just look at a dog and see how it walks and be like, oh yeah, that dog has hip dysplasia, or is it a little bit more complicated than that?
It's a little bit more complicated, but I think that we get a lot of clues. Again, these are young animals that tend to develop this condition because they're either born with it or developing it at a young age. And so I think some key things that can be seen in these young animals is these are puppies and they should be active and wanting to bounce off the walls. And if it's this dog that kind of wants to be less active or maybe lays around more than his other companions, and he does try to be active or exercise, maybe only plays for a bit of time and then lays down, kind of seems to tire out. And then another kind of common gait change that we might see in these pets is bunny hopping behavior, as opposed to kind of a nice long stride when they're running, as they tend to kind of hop with their back legs. And then another would be kind of shifting their weight onto their front legs because their back legs hurt or their hips hurt. So they really rely on their front legs, and they'll get these really beefy, strong upper bodies and kind of wimpy back end. So it can be subtle, and sometimes you don't see any of that. It's kind of just mild discomfort. And so a lot of times it takes a really good physical exam or diagnostic workup with radiographs to really know for sure.
Okay.
But so those are some of kind of the first initial symptoms that an owner may see in their young animal that could key into something like this.
Okay, that's wonderful information. And then I always have heard about kind of like this thing called the pen hip, or is that for hip dysplasia? Can you describe a little bit about that?
Yep, so initially when we're diagnosing these cases, again, a good physical exam with a veterinarian is very helpful, and then some survey x-rays to look at the marriage of the hip socket joint and see if it does look appropriate or not. There are some different specific tests that give us a more objective measurement of hip dysplasia, and with things like pen hip, there's another version called OFA. What we're looking for is there any laxity in the ball and socket marriage of that hip joint? What we should see with a normal hip is it should be a really tight fit and a perfect fit there. Those tests are radiographic tests that end up identifying increased movement between that ball and socket joint, which can help us predict how predisposed these animals are to be having problems in the future when they grow up, essentially. So it is a more specific test for us.
We've got a question?
Yes, Taylor would like to know, are there breeds that are more prone to it?
So it tends to be, there are definitely some key breeds. It tends to be our larger breed dogs as opposed to kind of the little, more pocket pet type dogs that ride in people's laps. Larger breeds, German Shepherds kind of hit the top of the list pretty readily. Definitely poster child. Some kind of the Labrador breeds and some of the giant breeds like Newfoundlands and things like that.
All right. And of course, we're going to get into the surgical options for all of this. But what are kind of the non-surgical options for these guys if they're painful?
A lot of it, having this abnormality in their development sets them up for being at risk of having discomfort in the long run. A lot of animals aren't necessarily debilitated at a young age per se. And so when we're trying to make these pets as comfortable as possible, a lot of the non-surgical options are formulated around rehabilitation and then joint supplements, basically creating as happy of a joint environment as possible. And there's a kind of a multitude of different joint supplements that we consider. But a lot of times it's working with a physical therapist, keeping them as strong as possible. And then another huge component is keeping these dogs lean so they don't get overweight. And now they're putting a lot of weight on these joints that are already compromised. So a skinny, active, strong dog tends to be a really good option in trying to stave off a need for anything really interventional right off the bat.
Great. And I don't think people realize how much physical therapy there is for dogs. There's people who do underwater treadmills here, so there's a lot of good types of physical therapy that we have for dogs right now. But let's get into kind of the surgical stuff. Dr. Derhowitz, why would you even consider any surgery for a dog with hip dysplasia?
Yeah, good question. That is, a lot of these dogs, not all these dogs, but a lot of these dogs, despite doing the conservative management, are going to be just really sore and painful. And so I think that surgery is an option for those guys. Where it gets tricky is that some of the surgeries that we have available to us, we only have small windows to perform them. And so, for example, there's a surgery called the juvenile pubic symphysiodesis, I'm just going to call it JPS for short, where the goal is to alter the growth plate as the dog's growing, which is going to result in better coverage of the hip joint so it doesn't subluxate, because that's one of the things that happens. And in order for us to do that surgery, we have to catch it when they're 16 weeks old. So otherwise the surgery is typically not successful, maybe 20 weeks at most. So most of these we just don't see these guys that early, so we miss it. Another example is what's called triple pelvic osteotomy or double pelvic osteotomy. And in that surgery, very similarly, its goal is to essentially capture that head of the femur from being able to subluxate. And so to do that surgery, and for it to be successful, we have to catch these guys before they have any major degenerative changes or any degenerative changes in the joint. And so usually these guys have to be less than a year of age, and in order for us to do the surgery and have it have a good chance of success, if we can catch them at less than a year of age, then we're probably at about a 90% success rate at improving these guys. But it's hard to say, hey, my dog's 6 months old and sort of trapped to making this decision now.
Right.
And it's
And it may not
expensive
be
too.
painful at that time, and the radiographs may not even be that suggestive.
Right, exactly. And one of the things that we'll see is a lot of these guys will have kind of what we call a bimodal, progression of the pain, where they might be very painful when they're growing up, and then they get more muscle or they grow out of it, where then at that point they become comfortable and they can go on for years being really comfortable. There's even one study that suggests that about 80% of dogs will become comfortable, and then later on in life it'll kind of catch up to them. Of course, they probably can't go as hard as a dog that, with normal hips, but relatively, good quality of life, as long as it's not like a high performance working dog, I would say. And surgery, surgery is not for everybody, for sure. And kind of the Cadillac of it all is, just like in humans, a total hip replacement. And interestingly, we started doing total hip replacements in dogs before we started in humans.
Really? Didn't know
because
that.
we figured it out in dogs for the most part, right? So it was developed in the dog for human use, and then eventually it became affordable. And it kind of came back to the dog, and it's still expensive, of course, but definitely now it's very much within our reach for a lot of these patients.
And do you guys have any idea of how many veterinary surgeons out there are doing total hip replacements? Like, how common is this procedure?
It's a fairly common procedure, but there's not that many surgeons out there doing it, I would say. I don't have a number for you, to be honest with you. I would say my guess here in Oregon, there might be 5 surgeons maybe doing it, 4, something like that in Oregon. As you get into the bigger cities, I think you'll find more of a demand, I guess.
So it's definitely great that we brought this to Central Oregon.
I'm super excited that we're able to do this, and we started our first hip replacement was actually back in 2018. So we've been doing this for a little while now, and it's been really fun. It's always really stressful because just like any surgery, there's a risk for complications, and the hardest thing for me is going into this thinking, okay, we're going to make you 100%, we're going to give you a new lease on life, so to speak. But there is this risk, and some of it ultimately can be out of our control. And that's the hardest thing. But most of the time, these guys do well. There's actually about a 95% success rate.
Really
which
good
is,
for this major surgery.
Cool. Yeah, looks like we have a question.
Awesome.
Yes, Ernie would like to know, what is the recovery time on a hip replacement?
That's a good question.
Yeah, great question. So what's kind of scary is these guys are typically walking immediately after surgery and putting more weight on the leg than you want. I would say, for the most part, when we do knee surgery, I think those dogs are more painful than the dogs that we do hip replacements on, which is fantastic, but also worrisome, because one of the things that really is important for the hip replacement to be successful is that we want the implant to have bone grow into it so that it's ultimately stable. So initially we depend on just friction to hold everything together, what we call a pressed fit. And with time, which is going to be about 4 months total, that bone's going to ingrow and make it totally stable. So the recovery time ultimately is 4 months before we let them go 100%. But it's kind of one of these things where we start a little bit of leash loss and then slowly more. So it's not awful. I would say the hardest part is going to be your first 2 weeks where the incision's healing, they can't lick, that sort of thing. And then it might get harder depending on your dog. If your dog's a total nut, then it's going to be hard to keep them quiet. And that's what makes it hard, because they think they're 100%. But yet we still have to wait. And I did bring kind of an X-ray. I don't know if it'll.
Yeah, let's get into the nitty-gritty of this
If you guys can see this, But this is kind of what it looks like after a hip replacement. And so what we do is we cut the head or the ball part off of the femur, and then after that, that allows us to enter this medullary canal here and drop a stem in there. So we essentially place a stem right into the bone, and that just snug fit in there. And then after we do that, or before we do that, also we also prepare what's called the acetabulum, or the cup portion of the hip. And so I brought this here with us, and so this is what a stem looks like. And you can see it has this kind of weird coating here, and this is the area where the bone grows into it. It's actually a really intricate, porous surface that stimulates the growth of bone into that area. And then what's nice is we can kind of select different size heads here depending on the size of the dog and depending on the size of the cup. Same thing with the stems, they come in different sizes. And then the cup looks like this. And similarly, you can see the cup has this weird surface that allows for bone to grow in. And it has this kind of plastic shell, and that plastic shell is what's called an ultra high molecular weight polyethylene. And so what that allows for is for really nice, motion, frictionless motion between the two implants for a successful hip replacement. So that's kind of the nuts and bolts of it, guys.
That is pretty cool, I have to say.
Yeah. And one other surgery I'll mention is that there's also what's called the femoral head and neck ostectomy. And that's kind of what we consider the salvage procedure, where if we say, hey, I really think this is neat, but I don't want to risk a complication, or hey, I'm financially strapped and my dog's in a lot of pain. Can we do something? And that's where the femoral head and neck ostectomy comes in. And what that involves literally just cutting that head of the femur off, so this part off of the bone. And most dogs, as long as they're well muscled and you do good physical therapy, you can actually take away a lot of the pain. It won't, and it's one of those things where biomechanically they won't be as good as a hip replacement, but from a pain perspective, you can actually do pretty darn good. And so it's still an option.
Yeah.
For and from a when can I do this? FHO, you can do that at any point. A total hip replacement you can do at any point. The one caveat I'll say is the more degenerated the hip is and the funkier it looks, potentially the more challenging the surgery. So more and more we've gotten braver at doing hip replacements on pretty young dogs. We'll do hip replacements on dogs as young as about a year old, maybe a year and a half old now. And the thought process is that, in a human, a hip replacement typically lasts about 10 to 15 years.
Okay.
And you are walking on that hip replacement on 2 legs. In a dog, you got 4 legs, so it's hopefully less wear and tear, and it's going to last longer. And for better or worse, hopefully the dog's going to pass away before that implant fails.
Right.
And so we've gotten a lot more, comfortable with the procedure, and so now we routinely place them in young dogs, and it seems to be, working, and it will last a lifetime for most of these guys. Yeah.
Awesome. Well, thank you guys so much for being on the show. You guys are a wealth of information. I think there's a lot of confusion about hip dysplasia out there. This really cleared up options for us, and there actually seems to be quite a bit of options for these guys. So, again, if you have audience, if you have any questions, feel free, even after the show, to message your questions, and we'll be happy to answer them. And also, please join us in 2 weeks. We'll be talking about grain-free diets and also the relationship between DCM, or dilated cardiomyopathy.